So in this, I would recommend that you take quick notes. There are certain words which are highlighted in red, they are mnemonics, and the words which are highlighted in yellow, they are high yield MCQ points or MCQ questions in the past. Okay, so keep taking quick notes so that it will help you enhance learning and revising the topic at a faster pace. Okay, so without any further delay, let us start with the ENT revision and climb the steps of ENT ladder. So here is the first question. Identify the structure marked by A in the image of pinna. So when we are trying to solve this question, read the options: triangular fossa, crus of the helix, incisura terminalis, and cymba conchae. Being an ENT specialist or being an ENT doctor, we are supposed to know all the anatomical parts of the pinna because it has surgical significance. At the same time, we are supposed to know the significance of each and every part. Now here, if you can notice in the diagram, concentrate with me. This part is called as ear lobule, which lacks cartilage. It is the soft tissue part of the pinna. Now there is something called as helix, and this is antihelix. Antihelix has two folds, anterior fold and the posterior fold. So the part which is located in between these folds, that is a triangular part. So that part is called as triangular fossa. And in the question, this part is marked by A. So our answer here is triangular fossa. But as you know that the question will not remain the same every time. So we have to know the significance and other anatomical parts of the pinna as well. So be with me. This is the helix, or we can call it crus of the helix. Here this part is the crus of the helix. This is antihelix. Similarly, there is something like a triangular shaped cartilaginous piece, that is tragus here, and this opposite to that is the antitragus here. Fine. Now there is some small part, a kind of fossa like thing which is there in between the anterior crus of the antihelix and the crus of the helix. So here I am talking about this part. This part is cymba conchae. What is the significance of cymba conchae? Moment the patient is having any ear infection which has progressed and gone into the mastoid cavity, that is the time the patient is going to have the tenderness in this region. Why does this happen? This happens because cymba conchae is the region which overlies the mastoid antrum. What is mastoid antrum? You all know. It is the largest mastoid cell where the infection is going to get accumulated at the first. Okay. So cymba conchae is the region where you can simply put your hand like this and check. So similarly, you have to check it in the patient as well. So this is the point where you will feel tenderness. The patient will feel tenderness here. Now there are few more important things. This is incisura terminalis. I am just marking it on the picture. This is incisura terminalis. Why is it called as incisura terminalis? This is the gap in between the two cartilages. One is the helical crus of the helix, and the tragus. So there is a small gap in between the two cartilages. So this gap we utilize while taking the end oral incision while doing tympanoplasty. Okay. And this is the incision. When you take it from here, you can avoid any damage to the cartilage. Okay. So rest of the structures, I'll quickly go through it. This is the external auditory meatus. This is the conchal bowl, and I told you already about the helix and antihelix. Fine. Let us go ahead. Now, as I was talking about end oral incision, it is also called as Lempert's end oral incision. Let us talk about this because this was also one of the previous MCQ question. Here, the Lempert's end oral incision has got three parts. Part 1 is inside the canal. which is the transmeatal incision. Okay. The second part, where from that incision we come outside and we try to make a third incision through the incisura terminalis coming outside. Now, why are we doing the third incision which is extending outside? Because most of the times this incision is utilized for doing tympanoplasty. What is tympanoplasty? It is the repair of the tympanic membrane by any of the graft materials. So the graft can be either temporalis fascia or the tragal cartilage or the tragal perichondrium. So to harvest that temporalis fascia, this incision becomes very, very advantageous, so that we can harvest the temporalis fascia from there, and through the same incision we can put it and graft the tympanic membrane.
To watch the full video, download our app on App Store and Play Store.